So I'm going to assume that this person's referring to a PU surgery or a perineal urethrostomy, which is a procedure for male cats that suffer multiple bouts of urinary obstruction. And the short answer to this question is no, I've personally never done it, but I do work at a facility with surgeons that do perform this procedure, so let's talk about it. The PU surgery is what we call a salvage procedure for male cats that suffer from urinary obstructions. Now, a salvage procedure just means that it's not the ideal solution. It does come with some complications, and once we do this procedure, we can't undo this procedure. So with that in mind, we really try to only do this procedure on male cats that suffer multiple bouts of a serious urinary obstruction. Now, in order for you to learn about the PU surgery itself, which obviously I'm going to teach you about, you need to know a little bit about the anatomy of a male cat's naughty parts, so buckle up because I'm gonna say penis. The first thing you have to know is that the urethra is the tube that takes urine from the bladder and delivers it to the outside world, which obviously ends at the tip of the penis. There it is! There it is! He said penis! He said penis! Now, when cats suffer a urinary obstruction, what happens is that tube either gets clogged up with debris or inflammation causes the tube to swell shut and urine can't get out. And a lot of times the problem area is going to be the very end of the urethra inside the penis. So the purpose of the PU surgery is to essentially eliminate the need for the end part of the urethra by creating a new port for urine to come out of. And we make that new port in a region called the perineum or the perineal region, which is part of where the name of this procedure comes from. Now, for those more comedically inclined viewers, you may also recognize this region as the taint or the gooch. The cat gooch. What happens during the actual PU surgery is that the surgeon dissects all of the tissue in that region to find the part of the urethra that's further up the pipeline than where most of the obstructions happen. They then open up the urethra kind of like a book and then suture the open urethra to the surrounding outside tissues in that open position, creating a permanently open hole for urine to flow out of. Now at that point, since the penis and scrotum no longer serve a purpose and they're at risk for urine scald, they're taken away surgically. And yes, that does mean that cats with this surgery are going to be more prone to leaking urine and getting UTIs because they have no way of closing that hole. That's what she said! Even with a successful surgery, cats that have FIC will still show clinical signs when the disease is flaring up, but hopefully will still be able to expel urine appropriately because they have an exit for urine that's never closed. And as I mentioned before, there are some complications associated with this procedure, and unfortunately, even though I feel it's not very common, regardless of the skill level of the surgeon, sometimes cats that have this procedure performed can still develop a true urinary obstruction. Okay, and I know that was really long and drawn out way of answering the question, but hopefully you guys learned a thing or two.